Um, we thank God for the gift of life and the grace of having everyone available to come to the final point of the virtual part of this program, training program. We've had lectures in the last weeks, 4 weeks, and I'll just give a brief recap and then we'll be on straight to the post test. So just a quick one. We remember when we started, there was an overview of the entire grant following the welcome by one of the PIs in person of Professor Priska and what was expected of the participants. Then we went to overview of sickle cell disease, its pathophysiology. This was delivered by Dr. Ezekiel Issa, and also took us through other clinical aspects in terms of SCD complications, the management of the disease. Of course, several questions and answers we attended to. Then the second week was when we had lecture on basic genetics, sickle cell inheritance, took us through some calculations, risk calculations of how you can compute when you have carriers of the traits, how you can compute the risk of coming up with an individual, a child with sickle cell disease. That was done by Professor Alex Osio Akoto. And then we were introduced to laboratory sessions in terms of hemoglobin electrophoresis, the tests, the testing formats, their sensitivity, because we've had cases of individuals who had an information of what they thought their genotype was until when shown otherwise. And we are given a better insight into how this can come about based on the type of laboratory technique that was used for them. Then we were introduced to newborn screening, carrier screening and testing. The lecture was given by Professor Nodu, who is the PI of this program. Then genetic counseling skills. This took place in the third week, where we had detailed introduction into how we carry out the genetic counseling process, how the process is, well laid out. Came across such terminologies as contrand, proband, and all of that. How we use symbols, what the symbols represent, how to construct a family genetic tree so that you can predict what is likely to happen in a family where you have carriers of the sickle cell traits. And then that was followed on by documentation and referral. Miss Evelyn Archibald took that wonderful lecture that we had. Then we had the psychosocial and ethical considerations, because in all of these, ethics cannot be sidelined. Ethics is paramount. This was handled by Professor Adebayo Adejumo. The communication and strategies. We looked at some case studies and all of that. And then yesterday we had a roundup of our lectures where we were taking through community engagement and advocacy. This was delivered by Emeritus Professor Jem Bede. I missed in Dr. Akinyemi Ofakunrin had taken us sickle cell disease in pediatrics, because that's where it starts from, which was a detailed one and an eye-opener as well. So we've gone through all of these lectures back and forth. Like they would say in my place, we've gone through adult education. And so this morning now, there's going to be a testing of the knowledge that you've gained. And so in the next minute, I'm going to hand us over to the program managers, and also I think Dr. Ogun will be helping us, where we will have the link to the post tests projected, and then each person will be given time for us to go on and attend to the post test. So I think if you permit me now, I will hand over to Dr. Ogun so that she just tells us one or two things and then we go ahead to the post test. Over to you, Dr. Oguma.
Thank you very much, Dr. Kotila. Good morning, great scholars. I hope the program has been worth it, because I must indeed say it was one of a kind, with the different resource persons we've had come and give us updates as it relates to sickle cell and its treatments. Having said that, we've had the pre-tests and we know how we took the pre-tests. The same thing is going to happen with the post-tests. And we're going to put the link on the chat box where everyone can see it. And you're expected to do that pre-test. And we should note that the pre-tests and the post-tests is compulsory, because it will determine your being given the certificate at the end of the day. And for those who will be selected for the 2 weeks physical hands-on training that will be done from next week. So I implore us to give in our best and wish us all the best. So can we have the post tests pasted on the chat box? Mr. Shala, can you help us?
I'll be checking to know when it's there.
Okay. Someone is asking a question. Please, is the most important ethical issues of genetic counseling in SCD? Is it a question?
Well, that can't be answered anymore this morning.
I think they mean what is the most. I think they mean, please, what is the most important?
Okay.
We're in the exam hall already.
So, okay. The post test has been forwarded to the chat box. So, and I believe that the post test, once you click on it, you'll start. It will start timing you. So ensure you finish before the due time so that you are not logged out. So all the best.
Yeah,
your
all
time
the best
now.
to you, participants.
Yes, your time starts now. And feel free to chat on the chat box if you have any challenge concerning it. Thank you. Attention, please, dear participants. Also note